Thanks for joining us and welcome to today's event on biological dentistry brought to you by Innovative Medicine. Today you're going to hear from several different practitioners. First up is Dr. Philip Malika of the American College of Integrative Medicine and Dentistry, who travels around the world giving lectures on ozone therapy as well as some of the other advanced techniques that you're going to hear about today. Following him is going to be Dr. Carly Yamashiro from Washington, who received her advanced education in general dentistry as well as a doctorate in dental surgery from the University of Missouri at Kansas City. And following Dr. Yamashiro, we're going to hear from two practitioners, Dr. Jill Morris and Dr. Wilbur Backey, who together run the Sarasota Dentist Clinic and are both biologic dentists as well as naturopathic physicians. So here to start things off and give us a little bit of an introduction as to what biologic dentistry is Dr. Phil Malika.
Well, I think the concept, was really developed when we realized that, the concept of controlling infection in environmentals. When we started to realize that the patient itself is really one thing, not separate little entities and sections. I mean, traditionally we're taught in dental school that life ends at the neck and doesn't exist beyond there. Well, as we became more understanding of our anatomy, physiology, and people as a whole, or the holistic concept, we realized that the influences of the head and neck have a dramatic effect on the rest of the body, meaning that any sort of chronic or deep infections, any kind of, let's say biologically hazardous dental materials have far-reaching implications. There are no barriers in the body that will not allow for these, consequences of dentistry and the patient's own health and wellness really not affect them. So through that, over the number of years, we realized the toxicity of heavy metals, the effects of deep chronic infections associated with poor extractions, possibly failing root canals or chronic infection from even the soft and periodontal tissue. Once again, still had far-reaching implications throughout the entire body. So the concept of biology is really to make the oral cavity in the head and neck as biocompatible with the rest of the body, meaning, in other words, non-toxic, environmentally safe for the ecology of the human body.
So what are some of the types of procedures or tools that a biologic dentist might use which a conventional dentist might not be equipped with?
Well, first of all, like I said, philosophical differences. I mean, we really look at things as far as materials and compatibility of materials. We look for toxicity. We look for materials that are non-toxic, that won't challenge the immune system in the patient. We're very cognizant of heavy metals. We're very cognizant of deep-set infections as far as root canals and deep infections associated with that. So we're looking at that, once again, we're looking at the patient as a whole person. So we really assess their health, their wellness, the implications of the dentistry on their whole body, and, the toxicity associated with that. So what will be different? I think procedurally will be different. We take, the model that we've really developed and that Dr. Thomas teaches for us is an integrative biologic dental medical approach. And what we do is, our definition really boils down to with our integrative model. You really need a model to work with. It's called integrative biologic dental medicine, and I'll give you the definition so that might help also. It's defined as dental medicine that partners the patient and the dental practitioner to develop and integrate biologically safe, effective, established, and emerging treatment modalities. So the beauty of the integrated model as far as biologic concern is really, it's not subservient to any one school of thought, where what we do with our patients really is what do they specifically need. We'll put all medicine and dentistry on the same playing field and pull down. For example, people have heavy metal toxicity. We know that the fillings that have been put in traditionally over the years are mercury-based fillings. Over 50% of those silver fillings, we call them, are mercury. And it is releasing. Every time they chew food and eat, they are releasing small amounts of mercury. So between the environment, the food supply, and fillings, we're finding that more and more patients have what we call heavy metal toxicity. So the difference between us and traditional dentists is that we have a multitude of precautions that we take for the patient. Number one, when a patient comes in, it's not like having a traditional filling done. The patients are completely protected and draped in mercury-resistant garb. Number two, when we do take the filling out, it is in an isolation chamber. It's a silicone cup that actually goes around and rubber dam. The tooth is isolated to prevent spillage of the mercury when it's released, because the dangers associated with mercury fillings are when you put them in, of course, and of course the danger is when you take them out, when you drill them out, the aerosol associated with that. So we have techniques that protect the patient and the dentist during those procedures. And that's all fine and good, but what's important too is that once these mercury fillings are removed, we put something back that is more biocompatible with their particular system. So we have technology and techniques that we can actually take blood samples and match up what is most compatible to their immunologic system.
One of the things I'd love to get your take on, because you're so involved with speaking and training other dentists in the ACIMD, is if you could talk a little bit about kind of a macro view of where you see the whole field of dentistry headed. And by that I mean including, patient awareness, because it seems that people are becoming increasingly aware of toxicity and these issues and seeking out, this type of treatment in all walks of their health, including dentistry. So how have you seen that, and how do you see that growing and changing over time?
Well, what's happening now is with public awareness, people are really interested in longevity, but beyond longevity, they're looking for health and wellness. And part of that, the awareness is becoming the health and wellness associated with their oral cavity and their head and neck. So what I see where dentistry is going in more of the biologic sense, it's more of like an integrated biologic dental medicine. There's going to be really kind of two worlds of dentistry. One is going to be the mechanistic model, which is kind of like the school dental model where, you're going to go get your, absolutely your traditional fillings done, your bridge work, your cosmetic dentistry, all that. And then you can have the world of dental medicine where it's really emerging, where we're looking at the patient as a whole. We're really helping them to help themselves, and that's really the key. We're looking at how what our work does influences their body. We take the time. You see, I think, like I tell my docs when I train them, I said, dentistry is in a beautiful place right now. It's amazing, especially if you're in the biologic world, the biologic integrated model, where we're really helping patients to help themselves, because in dentistry, it's a different model from the traditional medicine right now. Medicine in the allopathic model right now, they're very restricted on what they can do. It's very brief. Put a patch on you, get you out. Where here in our world, we're able to take the time and help these people. We talk about, gut physiology. We help their immune system. We give them, supplements. We make homeopathy. We talk about how we can keep them healthy, because we, the beauty of dentistry is that we have the time and they pay for it to allow them to help us to help themselves. And that's ultimately where we're really at. Through dentistry, biologic dentistry. A lot of our docs now that we're trained are becoming naturopaths also. So we're really integrating those procedures and concepts into our dental world. So it's becoming, beyond just drilling and filling. It's really becoming a wellness program.
That leads me right into my next question, which was going to be about how you see, or how you maybe any advice you have for the way a practitioner, a dental practitioner, might approach interlinking and intercommunicating with other practitioners to best serve the patient. Because as you mentioned, the conception in biologic dentistry is not of a patient as just a set of teeth or starting above the neck, but part of the entire system. So it would make sense, and I know it's a question for a lot of dentists, how they can get involved with, how they can better communicate with other practitioners to all kind of coordinate their efforts to bring about the best health results. How do you see that taking place with the practitioners with whom you work?
Well, first thing is education, is understanding what, the language of integration, or the language of biologic medicine. and develop a common language with your practitioners. I mean, I'm lucky I have Dr. Thomas. I have a number of other practitioners that I constantly communicate with, and it's really a matter of educating your referral base so they understand the absolute implications of chronic head neck infection, heavy metal toxicity, orthopedics of the head neck, and as far as even how a patient breathes and sleeps at night. These are significant things. And you have to, once again, really develop a relationship with these other practitioners. It really develops down to what we call an integrative team, where you have different individuals, you're dealing with biologic, other dentists also talking to them. You're talking to physicians. I mean, physicians now are becoming more aware of the outcomes, even post-surgically, that, if you have a chronic head and neck infection, whether it's a root canal abscess, periodontal disease, all these different implications, it affects the outcomes of their surgeries. So many surgeries have failed because of infections. And where the hell's the infection coming from? Well, it's coming from their mouth. There are no barriers here, Unfortunately, gravity sucks and everything drains down throughout the entire body. So, it's really developing a relationship, and that's really what's important. Is really developing what I call a sustainable relationship, with your colleagues and developing that. But first of all, you have to really understand what you're doing biologically. What are your ultimate goals? What is your philosophy? What is your mission for your patients, And we really, my kind of mantra is that I'm trying to help them to heal themselves as a healing process. And that's really the key, putting the onus of health and wellness on the patient. And as you guys seen, the worst patients are, heal me, heal me. Whoa, time out. I said, I can help you, but you have to heal yourself. You have to be your own best advocate. And that's one of the most important things. And that's why I love the integrative model, because what it does is it puts the patient right there up to you with the practitioners. They're part of the team. They're helping really make some decisions. Once I've seen patients from, even Dr. Thomas there, the patients that really become their own advocates, do what they're supposed to do, think about, getting to themselves better, getting well. It's a whole multiple level thing of healing. Those become the best patients, and those are the best outcomes. So getting back to the fundamental question is, number one, developing a quality relationship, a good common language, understanding, what we're talking about, what are our ultimate goals. Because what's important is, in my case, I see a lot of patients have Lyme disease, have heavy metal toxicity. So I'm cleaning up that entire mess. I'm making homeopathics based on that, as those mercury fillings come out. I take samples. I, imprint them in homeopathics. But I'm also working in conjunction with a doctor like Dr. Schultz, where he is really detoxifying and cleaning up the body as a whole. But he has to know what I'm doing too. How am I doing? What's the progression? And also, what's really, really important is that a patient comes in, are they healthy at a point where you can start taking these materials out in dentistry? You can start taking out possibly heavily infected root canals. It's not a matter, they just come in and take everything out and convert it. These people have to be built up to a state where they can handle that process of detoxification and the trauma associated with getting some teeth, unfortunately, taken out. Or can they handle root canals and therapy? So it's really important to get that moment, when they're ready, that they can possibly detoxify and clean up all the residuals associated with the problems in dentistry.
So lastly, could you tell us a little bit about the ACIMD, what your role is there, and where practitioners can go to get involved and where patients can go to learn more?
The American College of Integrated Medicine Dentistry, we formed it as really a educational group for education, number one, for research, to continue on the work, because we were all at Catholic University of Integrated Medicine at one time, and that school closed down. So a lot of dentists, trying to getting their integrative or biologic training really had no place to go. So what we did was we, developed our entity and developed a program that really deals with the integrative medical/dental concept, meaning that it's very difficult for a practitioner to go and learn or get a really deep overview of the concept of integrated biologic dental medicine. meaning that, you go, you get a little piece of the puzzle here, a little piece of, I'm getting homeopathy here, Chinese medicine. Where what we do in our program, we bring our doctors right from the beginning and tell the story, in this case, of our practicing model, which is integrated biologic dental medicine. So they go to one place. It's a coordinated curriculum. They have a curriculum that is designed for X amount of 120 plus hours of education and a lot more hours of homework. It's designed a set curriculum, X amount of hours. They are tested. They have a board examination. They have to do actually verbal presentations. And what's really important is that to defining our model. And when our doctors are complete with this program, is they are board certified in integrated biologic dental medicine. In addition, we have a relationship with the American Naturopathic Medical Association that board is certified based on their doctorate in dentistry, our work, our testing, our curriculum, that they'll also make them board certified naturopathic physicians. So it's a dual certification program. So conception, I mean, the point is they really have some place to go that put all the pieces of the puzzle together in integrated medicine and dentistry in a coherent, clear-cut fashion. Now, my role, I'm the president of the school, and my wife, Dr. Rockefeller, she's the vice president for logistics and management. And my job is to obviously lecture, but also to help coordinate our faculty and make sure the curriculum is constantly updated and managed correctly. That deals with the needs and the assessed needs of the individual students. So our curriculum is constantly changing, updating the newest and latest information. And as you well know, I mean, Dr. Thomas is part of our faculty, so we have the premier integrated practitioners of the world come in and lecture for us and train our docs.
Great. And what is the website that people can go to learn more?
acimd.net.
Wonderful.
Let me just confirm that. My son handles that, and we're updating that website. As you know, it's always some update going on.
Always, yeah.
Listen, if any dentist that's interested in really understanding and comprehending the concept of biologics and dentistry, I mean, our curriculum affords that. And I think this is really where the wave of the future is going, and patients are looking for that. And it's, it's an exciting frontier. The beauty of it is that, before I got into this whole concept, the just drilling and filling teeth was just, I would tell you, I was cracking up. I said, what the hell am I doing? I can't do this for the next 30 years. We're here, this is a beautiful thing. I'm actually really feel like I'm helping people. I'm educating the patients. I'm educating other doctors. So it's a really, it's a fun time, to say the least.
All right. And here up next to share her insight and definition of biological dentistry is Dr. Carla Yamashiro.
Well, I'm going to start by giving you the American College of Integrative Biologic Dental Medicine's definition, because it's a nice overview of biological dentistry. And so they say, quote, biological dentistry or integrative biologic dental medicine is dental medicine that partners the patient and dental practitioner to develop and integrate biologically safe, effective, established, and emerging treatment modalities. This allows for treatment that is not subservient to any one school of dental thought, end of quote. So, I look at this definition as that in this integrative biological approach, patients are really the center of the wheel, and that they participate fully in their dental health. And also in this type of model, we can find treatments that are individualized. So it's not a one-size-fits-all type of dentistry. We're all different. I mean, our needs are different. One problem that we might have in dentistry with a tooth or, with some dental disease, the cause could be different. So we have to look at all aspects of it and not have a cookie cut model, so to speak. So, methods we use might be different depending on what the patient presents. I mean, we might look at not only the physical aspects of what is happening with the patient, but also look at the mind and emotional aspect of it. We might look at spirit or energy. So we're looking at the patient as a whole, because patients are not just they're not just teeth,
Yeah.
they come with the rest of their body parts. So we really can't look at patients just based on their teeth. Yeah, we're more than teeth.
Yeah, that's interesting. A patient isn't just a set of teeth walking in through your door. Could you talk a little bit more about that kind of connection between, other areas of life, be it emotional, be it, physiological things that are going on, organs or systems, and the teeth themselves? What is that connection? Is it Chinese medicine? How do you connect those two things together?
Like, as a biologic dentist, when we consider the patient holistically, like I was saying, we mean body, mind, emotion, and spirit energy. So we do address physical components, the mechanics, biochemical, physiological aspects of patient's health. And even beyond on that physical plane, to consider the physical body in its entirety, because the mouth is really a reflection of the rest of the body. So, for example, we see inflammation of the gums. You can bet there's going to be inflammation throughout the GI tract. Just one long tube from the mouth, other end. So, the mouth is also the portal to the rest of the body. So, what we put in it matters. So, this includes foods that we eat and even the dental materials that we use.
So, talk a little bit more about the location of things in the mouth. Like, can you actually get a sense of what's happening in other areas of the patient's body by, say, seeing the location of a problem in a particular tooth or inflammation in a particular area of the gums? Yeah.
Well, yeah, I'll give you an example. I had a patient who came in because he had a root canal done on a particular tooth, and he said that for months after, he didn't feel well. He said, his lymph nodes felt swollen to him. You couldn't palpate it, but he said to him it felt like it was swollen. And so understanding this particular tooth that was associated with the meridian of the lymph, I was able to treat his tooth for the physical problem that he presented with, but also refer him to an acupuncturist so that his meridian channel could be rebalanced. So, it's important to know what's happening with the rest of the person, as far as maybe other symptoms that are presenting with the rest of their body, and even on an emotional level. I mean, we know that stress, for example, causes high blood pressure. If we're extremely angry, our blood pressure goes up. So we know that certain emotions and certain stressors can create physiological responses. So it becomes important then to know, what is the state of mind of your patient and what maybe emotional factors are happening within their life, because it has a direct relationship with, what they might present with and how treatment might look. Everything's connected. Everything's connected.
I'm curious to know at this point what type of additional schooling, a holistic dentist goes through, or that you've gone through to learn all of these different modalities and make these types of various connections.
Well, I received my biological integrative medicine certificate through the American College of Integrative Biologic Dental Medicine. And what that did, though, is it really expanded my view of dentistry and medicine in general. They brought in a lot of great teachers and speakers in their field, and just getting that exposure opened more doors.
What does that type of a program consist of? Like how long is it to get through, and is that something that that a dentist would decide to do, let's say after coming out of conventional, medical school, dentistry school?
Yes, we're all, we all go to conventional dental school. We're all basically conventional dentists. We don't, do away with conventional dentistry, but we integrate what we learn in conventional dentistry with biological dentistry. So this would be a program that a dentist would go to after receiving their DDS or DMD to continue and expand their knowledge.
Okay, so kind of to add another pretty thick and dense layer of knowledge and information on top of the just anatomical functions of things that you would learn in dentistry school. So going to your website, Dr. Yamashiro, I notice, there's a lot of therapies that you don't see on a normal, dentist kind of list of services they provide, things like ozone and proper removal of amalgam fillings. Could you talk a little bit about some of those types of services that you do, maybe starting with ozone?
Sure. So, ozone is a natural way of killing bacteria, viruses, parasites, and fungus. Basically, these bugs just can't live in an oxygen-rich environment. So ozone is a way of producing that oxygen-rich environment. And it can take the form of ozonated water. We also use injectable ozonated gas. So it's a really effective, natural, and safe way to eliminate these pathogens.
And insofar as amalgam filling removal, I know this is I bring this one up because it's something that's increasing in people's awareness, even in general awareness. Everyone is very aware of mercury and the harmful potential side effects of mercury toxicity. So what is the approach of a biological dentist look like when it comes to filling and removal compared with, say, a natural dentist? What do you consider that maybe that a conventional dentist might not consider when doing those types of procedures?
Well, yes, certainly mercury is in amalgam fillings is of a great concern to biological dentists, considering that over 50% of the amalgam content is mercury. And there's also, great concern also when it has to be removed because it's the vapors that, are harmful. And so when it is removed with the drill, we do inadvertently emit a lot of vapors, of mercury vapors.
Really? I didn't know that.
So, yeah, it's whenever the mercury is heated into its vapor form.
I see.
When it's harmful.
Is that I've actually heard that even drinking, just that you mentioned that, it triggered a memory that I've heard somewhere, that even if you drink very hot liquids, hot tea or something, that it can leach a little bit of mercury each time from fillings. Is that possible? Is that true?
Well, that's enough. That's supposedly enough to release the vapors. Even your mouth's own body temperature.
Wow.
Is enough to emit mercury vapors. So when we physically remove it with the high-speed drill, there's a potential for an extremely high amount of exposure, to the patient, but also to us dental professionals. So it's really important, that to use safer protocols. We're not going to completely eliminate the exposure, but what we can do is we can minimize the exposure, and that's really the goal of the biologic dentist, to remove it as safely as we can with as minimal exposure as we will possibly be able to.
And is that where also, in some way, supplementation comes into play? Because again, I think most people, when they think of going to their dentist, and I'm talking about the conventional, mindset, the mainstream, they don't necessarily think of their dentist prescribing supplements or things that help them with detoxification. But I noticed on your website and with other biological dentists and holistic dentists, they do offer a number of complementary therapies.
Right. And because, once you remove these mercury fillings, the bottom line point of this is the patient. And now, what does the patient need? As far as maybe possible testing for toxicity and for detox, we have to know what biological systems now need to be dealt with and what needs support. So I would say the very first thing we look at is testing, to test to see if there is a body burden even to begin with, because depending on that body burden, that will determine whether or not or how we approach detox. A person might have 10 amalgam restorations in their mouth, but if they're excreting the toxin, then typically they're not having any symptoms. But let's say they're not excreting it, then we're having a backup, and then we start to see symptoms. I like to explain to my patients in a way of looking at a kitchen sink. So, you have to be aware of whether the plumbing is flowing or not,
Right.
Let's just say, for example, like chelation, for example, it's really popular. But chelation is actually pulling, let's say mercury and other heavy metals from organs and tissues and then dumping it into the kitchen sink. But if your kitchen sink is clogged to begin with and you're not excreting that mercury and all that junk, then chelation can actually be dangerous, because then you're pulling out all of these toxic materials from organs and tissues, dumping it into a sink that's already clogged, and then
Wow.
and then you see crisis. Or another example, you have all of your silver fillings removed, your amalgam fillings removed, with no planning whatsoever, with no testing whatsoever, and dump all of that into the system. You have a clogged system that's not excreting. Where is that going to go? It has to back up. And so you sometimes you hear people say, or I do anyway, I hear patients say, they went to the dentist and got all of their mercury fillings removed, and they feel sick. Well, it's probably because they were already clogged. They were already not excreting the toxins that were that was already in their body, and now you just overload them with even more.
Wow. Yeah.
The body doesn't know, it can't process that, because it wasn't processing what was in there to begin with. So testing then is really primary. I mean, without testing for toxicity, we have no way of. We're only guessing. We'd only be guessing.
I see.
Without first having a test to determine how much of a body burden you have versus how much you're actually excreting it. So I think having that broader view, having that that holistic view, the holistic approach is really important.
Yeah. And I think that's a great note to end on, which is, holistic dentistry, biological dentistry, just to come back kind of full circle to what that really means. Because in this day and age, I've noticed that the word holistic gets used a lot, almost overused, and a lot of people just take it to mean in some way natural, or not using, medicine, or not using conventional procedures. But really what holistic means is just that. It's a whole view of the whole picture, as opposed to just one fragment of a bigger piece. And keeping things going, here's Dr. Will Backey and Dr. Jill Morris from Sarasota Dentist.
Biologic dentists also, as a group, we tend to look at the mouth being the gateway to the body, because that's where the start of the gut starts, there in the mouth, and ends down at the other end. But it is it affects all the biological flora in the gut, and the bacteria that is in our mouth. It affects basically every organ in the body, and biologic dentists look at the effects that the existing flora or issues that a patient has on their whole body, or anything that we do would cause on the rest of their body. Whereas in general dentistry, back in the day when I was taught, we gave absolutely no credence to the rest of the body. We were just dealing with teeth.
Mm-hmm.
And it's only been very recently, like literally in the last year, that most general medical people had any kind of onus or thoughts on the mouth giving rise to issues.
Yeah, and with the bacteria and the immune system, because of all the antibiotics that people have been on, their immune system is not working well. Now the bacteria invade the gums, and you have these open wounds and bacteria pumped into the bloodstream all the time as well. So we like to look at the whole person and try to build the body and do dentistry that is healing as naturally as possible. There are some really great organizations that have good continuing education. We're members of 3 different biological organizations. There's also a lot of ozone training. Most biologic dentists use ozone, and there are ozone organizations that are both medical and dental professionals go to, and we learn from each other. So ozone training, as well as the organizations, and then Burr and I both got our degrees in naturopathic medicine, just so we could understand even more the different modalities of an integrative medical philosophy.
Gotcha. Could you give me an example of what your approach would be to, let's say, an initial consultation of a new patient?
Well,
but one of the things I was going to say off of that is when we do a new patient exam, we get their medical history. And for instance, a diabetic, there's no way a diabetic can be a controlled diabetic. In other words, really be able to streamline the treatments if they have gum disease. And so we look at, well, you're diabetic, you've got horrible gum disease, we've got to treat that. Because most diabetics don't heal well anyway. But if we don't control the mouth and the bacteria in the mouth, there's no way they can control their diabetes. Most general dentists don't realize that or look at that. It's not something that we're trained with in general, whereas a more biologic dentist is trained in that aspect. And then as far as a mercury removal, I'll let Dr. Morse talk
Yeah,
about
we look at the mercury. We look at any heavy metals. We look at how that can affect the meridians of the body, how it can affect the cell communication. So we may ask questions about, has the patient had any heavy metal testing to see what metals they may be high in. We consider, first of all, supporting them with IV vitamin C and get them on some chlorella. And then after the mercury is removed, then we'll consider some type of chelation therapy according to what type of heavy metal they may have stored in their body. A lot of people have teeth that were removed to do orthodontics, so we have to consider cavitations. We have a CAT scan that also helps us to diagnose cavitations. We treat dry mouth with ozone reversing decay, as well as ozone to treat the gum disease, and just we're thinking lower the bacteria count and also change the terrain of the patient so that they are better hosts to whatever bacteria they may be exposed to.
My side of the practice is surgery. So, like when I have a patient comes in that has, horrible teeth, full of infection and things like that, I have to really look at their overall body health and get them healthy with the IV vitamin C, Myers cocktail, things like that, before I start taking out all his teeth, because it dumps a whole pile of bacteria and infection into their system. And if they're not ready to take all of that gets dumped in there, then it can make them extremely sick. Heart attacks, things like that can occur.
Mm-hmm. I'm curious at this point to know how well informed or educated or curious would you say is your average patient? Because all of the treatments that you described are truly holistic and require some in-depth knowledge of how all these different organs and systems fit together. And I think for the average person or the average kind of patient off the street going to a dentist, it would seem far removed for them anyway to go to a dentist and be treated for something or consider taking supplements. So could you speak a little bit about the type of patients that you see?
Probably 100% of our patients finally understand the heart connection with dentistry. Probably 50% of our patients that call today are looking for a holistic, and they're well informed. They've done their research on the internet. They may be going through Gerson therapy with cancer, Lyme's disease, and of course those patients we seriously need to remove the root canal teeth and things like that. So because they go on the internet and they find us through Google, under the holistic dental, I would say a good 50% of our phone calls now coming in are patients that are looking for a holistic dentist, and they are very, very well informed. And, we still learn a lot from our patients, those patients. And then probably the other 50%, we're educating them about their mercury. They had no idea that there's a problem with that, and that's about what the ratio is right now.
Yeah.
You mentioned the heart connection to dentistry. What is that?
That basically they have found living in the plaque. Now they're believing, they used to think cholesterol was the bad boy for heart disease. Now they're understanding it's more inflammation, and much of the inflammation is coming from the bacteria around the teeth being pumped into the bloodstream every time a patient chews or brings their teeth together. They are pumping that bacteria into the bloodstream and through the heart. And so they have, of course, found bacteria from the mouth living in the plaques of the heart. And
Well, the number of
inflammation.
recent reading I read, the main bacteria in heart disease, and I can't tell you what that is found in the mouth. And anything in the mouth, obviously we breathe it, we drink it, we eat it all day long. It gets into our bloodstream through the gums very easily. Any bleeding, which happens on most people, absorbs it all. So that's where the heart disease, they're starting to look more and more at that connection between the mouth and the heart and all the other organs. There is, most of us that are in biologic dentistry have either a flow chart on the wall. A lot of us have the apps on our phones now and computers, but each tooth in the mouth has a direct correlation to a body organ, body part, joints, different things like that. And so, yes, you can make correlations to that.
You can, and it can go either way. Like, let's say a right bicuspid could be connected to the breast, but if there's a problem in the organ, it can also affect that too. So it can flow either way as far as the problem goes.
Interesting.
Yeah.
And so for patients who want to learn more about biological dentistry, if they're in Florida, they can find you. What is the information for your clinic?
www.sarasotadentist.com, and that's a pretty thorough website. But we also have other websites. We have other websites that are just geared towards the biologic patient, because the mainstream dentistry, we get a lot of pressure from them here in Florida. So, we have to be a little bit careful how we advertise and things like that. So we have, if they Google holistic dentistry in Sarasota, they'll find our other website.
Okay.
I don't know how to word it, but our board of dentistry is not friendly towards holistic dentists.
Yeah, as an example of that, we fully believe that the old, quote, silver fillings, which are really mercury fillings, the ADA and the mainstream dental think they're safe and fine, whereas holistic dentistry and biologic dentistry think that they cause a lot of issues. In fact, the mercury vapors that go into the brain and the leading cause of tics and tremors and things like that, and other diseases. And we have very specialized ways of taking those out. But again, we fight the mainstream dentistry that claims that they're fine and good and no problem. We actually just read an article where there was a pretty major lawsuit settled. It took 14 years to do it, and unfortunately they didn't go all the way to the Supreme Court, but I think that would have ended the use of mercury-based fillings.
Really?
But they settled it, so it didn't make it out there. So, but there's those kinds of issues that we kind of deal with.
Yeah, we recently wrote an article that came out locally, and Bertot, he does ceramic implants. There aren't very many in the country that do that just because they have no metal or electrical interference in the body. And so, some of the local dentists turned us into the board for that and said that mercury was okay. And so we want to do what's right for our patients, and we're going to practice this, but we're pretty low key as when it comes to some of the things that we say, like over the phone. We wait until the patient comes in to really talk one-on-one with the patient.
Right. It's surprising to me still how careful you have to be when I would even say that it's kind of among the mainstream understanding, perhaps not the conventional medicine understanding, but it's definitely in the mainstream awareness that mercury is dangerous. You hear this all over the news. Everyone is up in arms about vaccines. It's huge issues on a daily basis. So the fact that this is still, in question when it comes to dentistry when they're literally just putting mercury into your mouth is really surprising.
Yeah.
Well, one of the things that we laugh about is there's only two places to put mercury fillings if we take them out or put them in. We can only store them in a very specialized hazardous waste container that is dictated by the federal government, and they have to be picked up by a specialized service or in your mouth.
That's right.
Yeah.
So it makes no sense.
It makes no sense. Do you know how that got started? Why were you using mercury?
Why what? I'm sorry.
Oh, well, mercury fillings were developed back in Civil War times, and they were a great filling material of the day. But as everything else progresses, we have better and better things. It's a very cheap way to fill a tooth. It's very low cost, so a lot of clinics still use it. It's still the number one seller for most dental manufacturing, supply companies. And they claim, there's a lot of claims to it, this and that. But there's been numerous studies that have showed that the mercury goes through the system literally in less than 24 hours. And if there's a fetus, it goes into the fetus completely in every organ system they have.
Oh, wow.
So, yeah, and it's been done for years. They've shown this, and it still fights issues. I think there's somewhere between 4 and 8 countries in the world that have completely banned the use of them.
Mm-hmm. And unfortunately, we're not one of them. We're kind of slow on the uptake of many of these things, just like I know the going through airport security is a similar situation, that in Europe they ban those ProVision X-ray machines, and here they claim that there's less radiation than a cell phone. So
right.
Yeah.
Yeah, so it's there's definitely a ways to go and a lot of room for progress. In your experience, what do you guys see as being, the future kind of prognosis for dentistry in general? Do you see it heading more and more of this biological dentistry becoming more in demand?
I think that as long as we have free internet, and the people of the nation are becoming sicker, and so they have the internet, and they will drive the profession. It's always been that way. Mm-hmm. Money drives the profession, and so when other dentists see that these patients, there's more and more patients wanting this, then more dentists will probably learn about it. So I think as long as we have the internet and the public can find answers to their problems, we'll be able to do this, unless the mainstream dental boards just crank the screws too tight. I mean, Burr and I have talked about if it gets ridiculous here, where would we go? But I think with the public, it's going to keep pushing in the direction of holistic dentistry.
I look at it like, there's been a huge insurgence of whole foods and organic foods. And it's getting more and more and growing. And I think that's the same thing that's going to drive dentistry. You're going to get more and more demand. And as the demand grows, dentists are going to have to learn it. We ourselves, one of our goals, and this is why we're doing the ACMOS and the Lecker instrument and the naturopathic medicine degrees, the BAH, all of that, is because we really want to open up a health clinic, so to speak, that has holistic dentistry, that has all of those other, naturopathic medicine, a regular MD that believes more in holistic care, BAH, all of that in one center, so you don't have to go anywhere else, because we find that's huge, especially in dentistry. You have one place to go. You don't have to go to 27 different spots. You're all right there.
Right.
And so we keep learning these newer and newer techniques so that we can do this. And we want to build this center so that it will, pass down from us as we retire and get older, and it'll keep going. Because I really believe it's the future.
That sounds like a great idea, and it sounds like a great solution to, what many view to be a current major problem in healthcare today, which is quite literally the disintegration of all the different specialties, how there's a lack of common knowledge, a lack of communication about specific patients. And like you mentioned in the beginning, how a patient would come to a conventional dentist and just be treated as a set of teeth. And then they'd go to a different specialist and just be treated for a joint or a rheumatic problem or something very specific without ever putting all of those critical pieces together. So I think that's great to hear that you guys are have that type of intention to reintegrate all these different aspects of health into one type of facility even.
Yeah.
Yeah.
Wonderful. So right now, if where can doctors go and where can patients go online to learn more about biological dentistry from a high quality source?
High quality source. There's the IAOMT, which is the International
Academy of Oral Medicine.
Right, IAOMT. Yeah, okay.
Well, MD. It's the International Academy of Oral Medicine and Dentistry. IAOMD.
Okay.
And
No, toxicology.
toxicology. Excuse me. Here's IAOMT. Excuse me. And that's a great source for dentists to start learning and go through training.
And the public. HDA, which is the Holistic Dental Association, is a good one. Mercola.com. He's got some great information about root canals, about the vapor off-gassing from the mercury, about gum disease. The Mercola.com has a lot of experts. He's got great videos of experts talking about this stuff.
Oh, great. That's good.
Patients will Google him, and then he links to us, and they call us from his website.
That's good to hear, because I know a lot of patients find him very, very easily. He does have a very expansive website with a lot of information, so it's good to hear that is accurate information and that it's beneficial.
I think it is. You get tired of all the supplements that he sells, but he's got a lot of really good information.
There it is. And of course, don't forget to go to sarasotadentist.com as well as innovativemedicine.com, where you can listen to more of these web events in advanced integrative medicine and learn a lot about what we do. So thanks again and have a great day.